Okay, so this video will cover the topic of the central auditory nervous system anatomy and physiology. Sometimes you'll hear it referred to as the CANS. Here are some structures we will talk about. We'll talk about the auditory nerve, which technically isn't part of the central. It's the last peripheral structure, but I always include it with the central system. Superior olivary complex, the auditory cortex, corpus callosum, planum temporal, and Wernicke's area, acoustic reflexes, and the pathway, and then the efferent, or the what we call corticofugal pathway, which is essentially from higher levels to lower levels. So just to remind everybody this of the auditory structures, or the central nervous system structures in general: the spinal column, the medulla, cerebellum, which is heavily involved in balance, but also over the last 20 or so years has been studied for cognitive processing and other types of processing, and found to play a role. The pons midbrain, the thalamus, which is that sensory transmission, all the sensory and motor information travels through the thalamus. Here you have the corpus callosum, which connects the two hemispheres, and we're going to talk about each of those. Here's a reminder of the different cortical areas: visual cortex here, the occipital lobe, the primary sensory cortex, sensory association areas, and the motor cortex all within the parietal lobe, and then the frontal lobe. You have prefrontal cortex, and here you have the temporal lobe and those auditory association areas, language reception area here with Wernicke's area, and those general categories and structures. I want you to watch this video on transduction, but here's a kind of a simple schematic of the central auditory nervous system. You have the cochlea and eighth cranial nerve here. First central structure is the cochlear nucleus on each side. The first part of the brain that the central system that receives input from both ears is the superior olivary complex, which we've talked about. Inferior colliculus, medial geniculate body, which is at the level of the thalamus, and then you get these association areas up here to the auditory cortex, which is kind of that final auditory area prior to language interpretation and processing. So one of the most important things that the auditory nerve does is it performs a function called phase locking, and phase locking is essentially neural firing that represents the period of the signal. Okay, and so if you think of like a spark plug in a car, right, it'll fire at a certain interval to keep the engine running, right? Well, phase locking is very similar. Okay, and so if you look, you can see here's the input waveform, here's a single nerve fiber, but then if you look at the bunches of nerves, auditory nerves, you can see that for each stimulus or each phase here, you get a firing, okay? But individual nerves can't fire that fast, but all of them together can follow this signal, okay? There you can see them. The volley principle, basically when a signal frequency gets higher, each individual nerve fiber cannot fire quickly enough, but as a whole, all of the fibers can then be combined and then accurately represent the phase of this signal, okay? So for higher frequencies, you have to incorporate numerous nerve fibers to keep up, if you will. And here you can see some nerve firings over time with number of spikes represented on the Y and then the activity on the X. The auditory nerve is tonotopically organized, meaning, remember, the cochlea is tonotopically organized, but so is the auditory nerve. Low frequency fibers on the inside, high frequency fibers on the outside. The reason why we see high frequency hearing loss when there is an insult or injury to the auditory nerve on the outside. Let's say an acoustic tumor grows against the nerve right here, let's say. The high frequency fibers are on the outside, they're compressed, and so therefore they're affected first. Again, we talked about tonotopic organization, higher frequencies, mid frequencies, lower frequencies, and then this is preserved to that structure. Now the superior olivary complex, it's called a complex because there's all these different components of the SOC, but let's just refer to it as the SOC, okay? They have both afferent, meaning towards the brain, and efferent activity, meaning from higher level structures downward. And again, this is the first area that receives input from both ears, okay? So the SOC, here you can see some structures. So there's efferents that are coming downward, right, that go down to the cochlea, okay, from the SOC area down to the cochlea. And then there are some some efferent fibers that go from the cortex down to the SOC and then down to the cochlea. So you can think of these efferent fibers as a modulator of activity, meaning that if there's a lot of background noise, if there's loud signals, let's say, they'll change the way the lower level system works. That's what these efferent nerve fibers do. The auditory cortex, temporal, or the tonotopic organization is preserved, as in other areas it's preserved all along the auditory central auditory system. Of course, the auditory cortex, that should be a parentheses right there, is located in the superior temporal gyrus, okay, which is right next to Wernicke's and the platum temporale. And so information that is encoded here is then sent to the language processing areas for interpretation. And cortical lesions, because this structure operates at a high level, right? This structure is not involved in a basic hearing test or an audiogram where they have to push the button when they hear the beep. That's more of a basic brainstem type activity. The auditory cortex is involved in higher levels, speech processing, interpretation, musical processing, and items like that. So the corpus callosum is a white matter tract that connects right and left hemisphere, has an auditory portion and other sensory portions. There's a concept called the interhemispheric transfer time, or the interhemispheric transfer of auditory information. And basically, the interhemispheric transfer time refers to how long it takes for auditory information to go from one side to the other through the corpus callosum, okay? The structure is not fully mature at birth and doesn't fully mature until late teens, early 20s in terms of maximum efficiency of transfer of information. So clinically, when we're testing children, teenagers, younger children, teenagers, and doing tests of auditory processing, there are tests that require information be sent across hemispheres. And therefore, we expect some differences in performance because of an immature or lack of maturity within the corpus callosum. Okay? For people who have intractable seizure disorders, where they're having abnormal activity in one hemisphere and then it's going to the other hemisphere and causing these seizures, many times they will do a commissurotomy, which is essentially splitting the brain in two. They sever the corpus callosum and they call those individuals, they refer to them as split brain patients, okay? And anything beyond that is a little more than you need, but you'll definitely talk about that in graduate school. So here's the corpus callosum. Here's a sagittal section, meaning it's a front to back section right here. and you can see the corpus callosum, the ventricle where the cerebral spinal fluid is housed and circulated. You can see the gray matter, right, on the cortical, on the 6 layers of the cortex, right? That's gray matter. And then within, you have all this white matter, okay? Brainstem and medulla, pons, there, it's all white, primarily white matter. Here you have some gray matter there as well. So Wernicke's area, so the auditory cortex is in the superior temporal gyrus in this area, right next to Wernicke's area. There's a set of fibers that course from Wernicke's area to the Broca's area, and they're called the arcuate fasciculus. Is the way I've been taught to pronounce it. But we know what Wernicke's area is. The planum temporale is right next to Wernicke's area, and it is involved in language processing. We know it's larger in the left hemisphere than the right hemisphere, has a higher density of fibers and so forth, suggesting that there is a left dominance for language processing. But still language processing occurs in the right hemisphere to a greater degree than we have thought in years past. So this one structure, one function, one side point of view isn't really accepted as much as it has been in the past. Here's the right planum temporale and the left, and you can see that's a larger area, more dense in fibers and that sort of thing. So again, that suggests a left an increased responsibility in the left hemisphere. Now, the acoustic reflex pathway, we'll spend a little more time on this, but essentially in audiology, we do a test called the acoustic reflex. And what the acoustic reflex does, it is essentially measures this pathway, both in an, let me get a pen here, in an ipsilateral and a contralateral fashion, okay? So by ipsilateral, I mean within the same side. Contralateral, I mean on the opposite side. And so we do testing and we assess ipsilateral, contralateral pathways. Sorry, that's not straight. But what we do, and then it follows a certain pattern. It goes from the inner ear to the 8th nerve, cochlear nucleus, SOC. It's important for binaural processing. Then it goes to the 7th nerve, and then back to the middle ear muscle. Okay, so this is the pathway that it takes, and I want to erase all of this. I'm not sure I know how to do that. So that's the pathway it takes, and we'll talk a little bit more about the acoustic reflex pathway. But I like to show it because it highlights the central auditory nervous system's role in auditory processing. There's the ipsilateral, there's the contralateral. And then we talk about the efferent auditory pathways. So the corticofugal projections, meaning from the auditory cortex down to the inferior colliculus and then down to the superior olivary complex. And then you go down to the cochlea. So essentially, these efferent pathways provide a feedback loop, essentially. Hey, this is going on up in the auditory cortex. Let's change the way we're processing things at the other levels. Okay, so those are efferent pathways. So again, higher levels communicate with lower levels, and then higher levels communicate with even lower levels from the auditory cortex down to the cochlea. Okay, and again, we'll cover this a little bit more. All right, that's it for the central auditory nervous system.